Hey, Dr. Sean Suda here. So let's talk about gallbladders for a little bit. Gallbladder removals are one of the most common operations in the United States and really around the world. So the problem is in some patients, they're genetically predisposed, or they're female, or you're overweight, or you have some other problem like acute weight loss or rapid weight loss that contributes to the formation of gallstones. And gallstones in your gallbladder can cause a number of problems. Now, the majority of people who have gallstones don't feel anything. But if you do feel something and you've experienced this before, you have a loved one who experienced it, it's very painful. You have pain in the right upper quadrant of your abdomen, just sort of right under your right rib cage. And it became horrible pain. It can be intermittent pain. It can get worse with certain kinds of foods, such as fatty foods. But there's several things that can happen with these gallstones besides just pain. The stones can exit your gallbladder and block up one of the ducts that come from your gallbladder to your intestines. That's called choledocholithiasis, and that can be a problem because it obstructs bile back up into your liver. And then you can get acute cholecystitis, which is an inflammation and possibly infection of your gallbladder, and that requires an emergency operation. So there's a lot of implications to having gallstones. One of the important things to know when you approach a surgeon is their experience with gallbladder surgery, how experienced they are with laparoscopic surgery, which is really the standard of care for gallbladder surgery. And they're going to tell you about certain complications. The biggest complication with gallbladder surgery is a common bile duct injury or biliary injury. That is, when the surgeon is removing the gallbladder, they either misidentify the ducts that come from the liver, pass your gallbladder into the intestines, and one of them are either clipped and ligated or obstructed or damaged so they leak. And that can be devastating to the patient. That can require multiple operations, that can make you very sick. And so that's a type of complication that really should not happen. It does happen, but as surgeons, we should take every precaution to make sure that doesn't happen. So when you see your surgical consent, they may mention that they're going to use possibly certain modalities such as X-ray, also known as intraoperative cholangiogram. They might possibly open your surgery if they're uncomfortable with the anatomy during laparoscopy and they need to make a bigger incision to just be really safe with your gallbladder removal. They might have something called firefly or fluorescent cholangiogram. That's something that's present with robotic surgery and other types of laparoscopic surgery that helps us see the ducts using certain types of infrared imaging and dye that you inject into your veins. All of these techniques help us to identify the biliary structures and avoid common bile duct injury, which is the most feared complications from our standpoint when it comes to gallbladder surgery. But for the most part, it's a safe operation. It can give you great relief from the symptoms that you have, and the recovery can be outpatient surgery. You can return to work within 1 or 2 weeks.